Chairman, Dr. Guzman, members of the board, good evening.
Evening.
The minutes that you have before you, I believe, in the board packet are then the concerns and information that I brought forward at the last board meeting a month ago. Since then, I'm happy to report that we've been able to enter into dialogue with Dr. Guzman, the administrative team, and we're reviewing the council structure process. I really appreciate some of the information that was forwarded by Dr. Romero. That's been very helpful. We're to meet on Monday, I believe, to evaluate what would work better, more equitably and more accessible as that process. I don't guess I'm letting anything out of the bag, but there's certain conversations then about perhaps reducing the number of councils, perhaps trying to stagger them onto Friday morning opposite faculty senate so that Friday morning is contributed to some of that participatory and shared governance process. That does not leave enough time then for all those councils necessarily to meet. Some may move into then Friday afternoon. There's other review at looking at maybe a 3 to 5 time slot Monday through Thursday to see where that time slot could begin. But that's a big improvement, and we're glad to have that, and we appreciate the time and consideration that's come forward to enable that and allow us to then really rediscover or re-enter into a conversation about how these structures can work for the constituents of the college. Other issues that are finding their way through Faculty Senate, adjunct faculty concerns around Affordable Health Care Act are entering into concern. We met with Dr. Guzman yesterday, and some of that was discussed, and so that's just kind of an ongoing conversation really at this point. There's an active concern by some members within the adjunct faculty community about will they be eligible, what is their role in the college on an ongoing basis like that. The role of that constituency, I think, is always something of a challenge. And so then in the communication that Faculty Senate had addressed to Dr. Guzman and the board last March has been followed through on, and now Jill Carlson, who's the new, I say AQUIP officer, but I think her actual title is Director of Assessment and Accreditation. And so then we're in a conversation with Ms. Carlson and Mr. Morimoto about investigating whether to do an AQUIP action project that evaluates the college's relationship to its adjunct constituency. And the idea then to do that is to see memorialized in some type of formal process of what the role of these people teaching at the college do for the college and what that relationship is. There's a broader concern nationally that some of the adjuncts have located or have identified and are interested in, seeing where that role falls for them here, really. I've been with the college for 14 years, and perennially, the role of adjuncts percolates up into the consciousness of Faculty Senate. And it's not something that we as a body have been able to satisfactorily address in that time, and moving it to an AQUIP action project, which has not been approved yet, but we're in the initial part of process on that to see if that can be addressed, and Santa Fe Community College can take kind of an active role in addressing some of those needs. With every turn of that perennial reoccurrence of that concern, and I can count this as the third iteration of this to be voiced rather clearly within Faculty Senate over the 14 years that I've been in service with the college. Each group of those adjuncts thinks that's the first time, and they're the ones only in that role discovering that. And so we're trying to encourage the college to, realize that and see if we can't address or, make this constituency feel more engaged or more part of the team and that. And I think that more or less captures the main issues that have been before us since last we met a month ago. Is there any questions or concerns that I can help with?
Well, just as a side comment, I went to a national conference for boards of community colleges, and in one of our meetings, they were talking about increasing faculty, and I was very proud to say, and then that we have increased the faculty,
yes.
And that now that I just heard that as we're doing a restructuring here, that we would increase the faculty even more. That's a national thing. People are really, the other community colleges and boards of directors are really seeing that, that's really the focus of everything. If you have a great faculty and if you've increased the faculty, it's going to make your school so much more successful and effective and stuff. So I'm just, that's the thing. I was very proud of the college, and I was really bragging in that workshop of how we've increased our faculty, and now that I heard that we're going to do it possibly even more, I just wanted to mention that to you. So that
great, thank you. We're very appreciative of that and the effort that took to get there. I think, I'm not sure what the numbers are in front of me. We've asked for information from institutional research to provide, but it's a good time for the college, I think, to be looking at this, because you can show a leveling or some movement in the ratio of adjunct to full-time.
Right.
And it's been, it's
Years.
Yeah, it's a good time that way.
So I have a question about so how many hours would a part-time faculty work? Would they be considered 30 hours, 20 hours? I know it depends. Some people are teaching one class, some people are teaching 3.
Yeah, it varies.
Carla's here.
Probably.
Carla, do you want to address that? Or? Okay.
Board Member Single, right now our policy says an adjunct faculty member is not supposed to teach more than 9 credit hours per semester. As we all know, there's been exceptions.
A lot of exceptions.
There's been a lot of exceptions over the years, but we're trying to enforce that policy at this point in time and deal with real exceptions, not exceptions being the rule. That is the current policy.
So when we look at full-time, part-time employees, I guess we don't attribute a number of hours a week, or do we?
Yes, we do. So what the reason, and so the plan is right now, if a person teaches 9 credit hours, we assume that it's 3 hours of work time per credit hour taught, so that's 27 hours per week, which is still under the 30
hours
right.
Before they become eligible for benefits.
And that's this is being looked at nationally. My understanding from talking with some of my counterparts at a recent meeting, we may have a waiver since we're a large employer till January of 2015 before we have to implement. That's still questionable, but we're still trying to see how to deal with this, because there's a lot of the rules and regulations. Right now, if somebody was teaching more than 9 credit hours, they're eligible for health care in January, theoretically. But if they aren't teaching in January, they're still eligible.
Based on the new regs?
Yeah. So there's some things that has to be worked out on that. Whereas if a person's a regular employee and quits for whatever reason, they would be off the healthcare system in January. So they've got some things they've still got to clean up. They're working on it nationally.
Right. And what we suggested when I talked with the faculty senate is that I'm going to call Secretary Garcia and see if he can give us somebody that's a real expert in this, so that we can bear more expertise into what our policies are than just kind of reading the law and trying to follow it.
Martha?
There was a great deal of discussion at the ACCT conference. There were several major sessions on the Affordable Care Act. And while the feds have not yet determined what the ratio of hours to credit hours taught, there were a number of institutions who have actually put in place their own policies in anticipation of what that would come, because as it now stands, I believe penalties begin to be assessed in February. So that was one of my questions about where were we on that. So when you talk about 3 hours, you can teach 9 credit hours and 3 hours of preparation time or actual time. To make the 27 is still less than the 30, but if you do a waiver, you automatically are buying benefits at the way that the schools are interpreting it, lacking regulations from the Fed.
What do you mean buying a waiver? A waiver? What do you mean?
Well, if a faculty member teaches more than the 9 credit hours,
Right. Then they become
then
quote
they
full time.
Then they
That's right.
become well here. Yeah, they become full-time according to the.
Yeah. Well, they don't become full-time, but they are able, they should receive the health benefits.
Yes. and-
Full-time-
and Feds will consider them full-time.
Yes.
At 30 hours.
Yes.
The other concern that I had about the Affordable Care Act is what we're doing about employees who are making, who are not making enough money to, who are, I don't know if they're grandfathered, I don't know what the term is, but who are eligible and for whom the institution has to provide medical benefits. And I don't know what the,
I don't understand your question.
Well,
yeah.
let me address that. So there's two different things that are competing with each other right now. One, now under state law, the college is mandated to pick up a certain percentage of healthcare costs based upon where your salaries are. The lower your salary is, the higher the percentage. But in the Affordable Care Act, if you're below a certain percentage, it's different. So
Well,
we've got to
if
get that straightened out
If
too.
your co-payment exceeds 9% of your total
Right.
salary,
Yes.
then you can go to the exchange,
Correct.
which may or may not be cheaper. But you might get a subsidy. I mean, and we do have, our lowest wage is in the $10 an hour range.
Yes.
So people would definitely be eligible for subsidies within the health insurance exchange, which might very well be cheaper than
Maybe cheaper.
But the
what they
institutions
pay.
have got to provide information about the exchanges
Mm-hmm.
that are available to those employees.
Once we know.
Yeah, I think that's going to, at some point, there's going to be an exodus, I predict, into HR, looking for somebody to help to sort this information out
Yeah.
on our end.
There's no doubt.
And then I think we should try to be proactive and be prepared to either
Yeah.
like assist in that or steer to the right direction.
Exactly.
Well, we were supposed to send out a notice to everyone.
We did.
Did we do that?
Yeah.
Okay.
Andrea?
My question has to do with accreditation. How does the agency look at the number of hours taught by part-timers? Do they have a limit?
Well, it depends upon, like, we just had our nursing accreditation.
Well, I'm talking about, yeah,
So it just
Yeah.
it's by program
That's-
area, it's different.
that's different, but
in nursing,
for the
more than 50% of your adjunct have to be master's degree. They do look at the percentage. I don't think, in general, there isn't anything that the North Central Association has looked at
for the rest.
requirements. I think some other accrediting associations
Yeah.
do have some rules,
Sachs, yeah.
but North Central does not,
Wow.
best we can tell.
Hmm.
'Cause it didn't come up in our last accreditation visit. We thought we were pretty
Yeah.
high on our adjunct faculty percentage.
Thank you.
Yeah.
So
Thank-
maybe we should have a report every month until we figure out what we're supposed to do with ACA, just an update.
Yes, and this is one of the things I haven't had a chance to talk to Dr. Guzman about because I was in a meeting last week. Kathy, Board Member Keith was there along with some other people from the UNM branches. And I got some feedback on what they're looking at, and I was going to propose we put together a sort of a team because it affects not only HR, the budget, and academic affairs. So we were going to try to put something together to try to do some research on some of the national initiatives. There's some guidelines that have been put out by some national associations, and I'm waiting for copies of those to come to me. So
And I'm sure we have employees who don't elect to have our insurance, and they may be uncovered, and they have to have insurance
Correct.
or pay their fine starting.
and we do have a lot of our adjunct instructors, even who right now teach more than the 9, who are covered through their other
Right, a spouse.
or their other employment. And a lot of ours are happening right now in our nursing program because of the
Yeah.
clinical
Oh, yeah.
hours. Okay, and most of them are working full-time at the hospital, so they would be exempt from some of the requirements.
Without a carefully defined policy, we're subject to penalties.
Right. Okay.
Is that it?
Thank you.
Thank you.
Thank you.
Thank you all.
Randy, thanks.